Good morning, everyone. This is our presentation on public health nursing, starring Lexi, Amanda, Kelly, Kaylina, Heidi, and Hannah. Public health nurses provide essential public health services and require skills in epidemiology, statistics, health promotion, disease surveillance, community health assessment, and policy development, as well as the ability to quickly respond to threats to the health of the public. Epidemiology is the study of the distribution and determinants of health-related states or events, the application of the study of diseases and other health problems. Disease surveillance is defined as a nationwide collaboration to share health information to monitor, control, and prevent the occurrence and spread of infectious diseases.
In 1893, the term public health nurse was coined by Lillian Wald, who devoted her life to caring for the ills of the poor. Wald attended the New York Hospital School of Nursing. After personally seeing the poverty and hardship endured by immigrants on the Lower East Side, she founded the Henry Street Settlement. Wald and her colleagues provided health care to impoverished families in their homes. Henry Street also offered innovative and effective social, recreational, and educational services. Wald understood that some diseases are beyond an individual's control and that the treatments prescribed need to take into consideration the patient's economic and social needs. She believed that all people should have equal access to health care. Wald started the public health campaign to further educate and help those in need. Wald wasn't the only nurse to practice nursing in the community. However, she did establish herself as a courageous national leader in support of social reform and the advancement of public health. With her establishment in New York City, Wald initiated the public health movement.
Public health nurses do many different things. They monitor health trends and identify health risk factors unique to specific communities, set local priorities for health-related interventions to provide greatest benefit to the most people, advocate with local, state, and federal authorities to improve access to health services, design and implement health education campaigns and disease prevention activities, educate and provide direct health care services to vulnerable and at-risk populations.
Public health nurses help the community as a whole by providing TB testing, blood sugar screenings, vaccinations, assistance during natural disasters, and education on smoking cessation, drug use, healthy eating, benefits of regular exercise, abstinence and safe sex, proper hand washing, and risks for hearing loss. Public health nurses also help new mothers, teen mothers, newborns by doing home visits which reduce hospitalization days and increase immunization rates. They also help the homeless, people who struggle with obesity by providing weight loss strategies, people with disabilities, veterans, the elderly, people with behavioral health issues, correctional facilities by giving referrals to community agencies and housing upon release, victims of domestic violence or child abuse, people who suffer from STIs, HIV, or AIDS, women by providing breast cancer and cervical cancer screening, and men by providing prostate exams.
Because of their many responsibilities, they work in a wide variety of places. This can be anywhere from small local communities in an immunization clinic to working for the national government at the U.S. Public Health Services. There are even jobs for public health nurses at the United Nations. There are even many job opportunities locally for public nurses, such as at WIC, Women, Infants, and Children, where they arrange care for pregnant and postpartum women, infants, and children. Life Choices Women's Clinic is another one where they provide medical care for pregnant women and other women's health needs. At Golden Gate Community Center, they provide health care to the elderly and children. Children's Rehabilitative Services, or CRS, is a multidisciplinary care for disabled children. Domestic Violence and Abuse Consulting Services gives emotional and sexual health resources to those in need. Most public health nursing jobs require a minimum bachelor degree for entry-level jobs and a master's degree for advanced practice jobs. There is little demand for advanced practice nursing, however. The ANA also offers certification in community public health nursing. Public health nursing has an excellent job outlook, and the average salary is between $51,000 and $55,000 a year.
Now I'd like to introduce our interviewee, Jeanette Tupper, who is currently working as a public health nurse.
This interview has been reenacted by Heidi and Amanda. This product is meant for educational purposes only. Use only as directed. This product is not intended to treat boredom. May be too intense for some viewers. Contestants may be briefed before the show, pre-recorded for this time zone.
What do you like best about working in public health nursing?
Working as a public health nurse is very rewarding. It gives you a chance to give back to the community, helping families with their health needs, including the homeless and undocumented individuals.
What do you like least about working in public health nursing?
It's not that I like anything least about working as a public health nurse, although the hours can be long at times due to any current situation.
What is most rewarding about your job?
Giving back to the community, helping families with their health needs, including the homeless and undocumented individuals, making a difference in people's and families' lives every single day, as well as saving lives.
What are some characteristics of people who are successful as a public health nurse?
Experience, caring, thoughtfulness, and lots of endless empathy. Someone who is willing to go above and beyond to help people.
Are there many opportunities for advancement in this field?
As with any given job, there's always room for advancement.
Where do you see the field of public health nursing going? Do you think it's a growing field?
Public health is an ongoing, never-ending field of nursing. The community always has peoples and families in need. That will never change.
What is a typical day like for a public health nurse?
Every day is different due to the cases a public health nurse encounters. Every day is always busy, too. The public is sometimes in crisis, meaning they're sick or they have no health care, or perhaps they just became homeless.
What advice would you give someone who is interested in going into the field of public health nursing?
Experience. Most places won't even hire an RN without 2 years of hospital experience. Experience gives you great assessment skills. An RN without good assessment skills isn't just useless and helpless, they are dangerous. Working as an RN, you are always dealing with people's lives, meaning there is no room for error, ever. You can never make a mistake when working as an RN, because one mistake can be fatal.
Public health nursing is constantly evolving. Public health nurses continually find new ways to meet the public's ever-changing needs in unique and innovative ways. Public health nurses go into rural communities where there is no access to healthcare and set up portable clinics. Public health nursing is evidence-based and is always studying the population, finding what the main problems and health threats are and finding new ways to solve them. This is done by creating programs and policies to help solve the problems. An example is community gardening. Incorporating community gardens into urban cities have helped teach about healthy eating, promote physical activity, and provide high-quality produce. This is just one example of an innovative way that being a public health nurse can impact the world around you. The future of public health nursing continues to be an essential part of healthcare and provides very diverse and creative opportunities.
created using Powtoon.